Hi everyone, this is Dr. Miggy. I'm a chiropractor in Austin, Texas, and I'm passionate about helping you overcome lower back pain. In today's video, we're going to talk about 5 ways in which you can prime your mind so that you can beat chronic pain by having a positive attitude. So there's a discussion around the biopsychosocial model of health. It's a very long term, but what it means for you is that pain really has 3 components. The first component is the biological component, which is your muscles, your joints, the things that can be broken that can provide you with pain. In the case of lower back pain, think of the discs, think of the vertebrae in the spine, think of the ligaments and the muscles that surround the spine. All of those things, whenever they're broken and cause pain, those constitute the biological component of pain. That's truly what most people think about when they think about pain in the lower back. However, lower back pain, just like any other chronic pain, has 2 other components that are just as important. And in today's video, we're going to talk about one of them. In the next video, we'll address the next one. So the second component is the psychological component of pain. How your mind operates really can help you overcome chronic pain very successfully. And the third component, which we will address in another video, is the social component of pain. Yes, you heard that right. Your social life is an important factor in helping you overcome or helping you stay in chronic pain. So in today's video, we're going to address 5 ways in which you can have a better psychological perspective on chronic pain so that you can be successful at lowering and eventually even mastering your chronic lower back pain. Tip number 1. Understand that chronic pain is a wave rather than a line. So a lot of my patients feel that whenever they're doing the right things in order for them to overcome lower back pain, they would expect pain to get better in a linear fashion, meaning today should be better than yesterday and tomorrow should be better than today. But the reality is that pain does not behave that way. Pain behaves more like a wave, meaning you're gonna have high days, you're gonna have low days. Along the way, pain is going to not behave in a predictable way. However, what you want to observe is you want to observe for trends, meaning, are you feeling better this week than you did last week? Or are you feeling better this month than you did last month? Can you walk farther today than you did a month ago? Things like that will help you understand there are trends when it comes to chronic pain, instead of being focused too much on the intensity of pain day after day. Think of it as a stock in the stock market. If you want a stock to improve, you are not expecting that stock, or you should not expect that stock to improve in a linear fashion, meaning it's more expensive or more valuable today than it was yesterday. Tomorrow is going to be the same. No, because you're going to lose your mind. The reality is that stocks go up and down, up and down. But what you do want to observe in your financial life, especially in the stock market, is that the stock price goes up and down, but has a positive trend, meaning it's more valuable this month than it was a month ago, or 2 months ago, or 6 months ago. The same happens with pain. You want to make sure that you're feeling better today than you did last month, but do not be overly focused on the intensity of pain day after day after day. If you have that mentality around pain, that pain behaves in a wave fashion, you're going to be much more successful at dealing with your chronic pain. Tip number 2, a positive mindset, or when we have positive thoughts, we actually change our neurophysiology, or the way our brain works. And that also affects your ability to experience pain. So what I mean by this is that if you are very diligent about looking after your thoughts, if you have good thoughts, bad thoughts, make sure that you surround yourself with people and also with entertainment that fosters a positive nature in your mindset. Instead of looking at very negative information, Try to surround yourself with people who make you laugh, who give you positivity. And this positivity is going to help you actually change how your brain works and how you're able to experience pain. The more positive your mindset is, the more likelihood you have to actually overcome chronic pain by having the right attitude. So for example, what I recommend some of my patients is that instead of watching too much news or too many shows that are violent in nature, try to observe good comedy, things that make you laugh. Also, try to get out more and see the beautiful skies and see the beautiful nature around you. There's been studies that show that contact with nature can definitely help you lower your chronic pain. And that's why whenever you go to a hospital, especially if the hospitals were built recently, you're going to observe a lot of nature that has been designed into the spaces of the hospital. Looking at nature is really important. So surround yourself with people who are positive, watch positive entertainment, and get out more and look at nature. All of these things are going to improve the positivity of your mind, which will in turn help you lower pain levels and deal with chronic pain in a more successful way. Tip number 3, do not allow your pain to dictate your level of physical activity. This is extremely crucial. So this is what typically happens in a chronic pain patient. You experience, say, pain that is 7 out of 10 or 8 out of 10, and the patient wants to stay at home, watch TV, eat junk food, and just chillax, essentially, for lack of a better term, so that they don't have to experience pain by being active. This is absolutely the wrong strategy. With chronic pain, considering that you don't have a major fracture or a major structural problem with your body, if you can walk, for example, I encourage all my patients to walk a little bit. Walking has been shown to increase a lot of health markers, including improving the health of the joints, improving the health of the musculature around the lower back. So it's only going to help you be more successful at dealing with pain. The most successful patients still experience chronic pain, but they do so in a way where they're still active and they're able to walk. And this is going to help you overcome a lot of the mental aspects of chronic pain. Tip number 4. This is a huge deal with chronic pain patients. Their minds tell them that they're never going to get out of pain. The word never, try to really kick it out of your vocabulary. Instead of thinking that you'll never get out of pain, think of what you can do today to improve your situation. Never just catastrophizes pain and it makes you not want to take action. But if you take positive action today to overcome your lower back pain, you're going to be much more successful. So say, for example, you come back home from work and you're feeling pretty bad with chronic pain, especially lower back pain, and you're having a 7 out of 10, 8 out of 10 day. Instead of thinking to yourself, oh, I'll never get out of pain, it's always gonna be this way, thinking of a future that is completely uncertain, focus on today. So instead of not doing anything with your 8 out of 8 pain, or 8 out of 10 pain, try to get on the foam roller. If the foam roller is too uncomfortable, try to stretch or do a couple of yoga poses. After you do your yoga poses, you can go for a walk around the block. This is not going to kill you. It might be uncomfortable, but you'll know that it's only positive for your lower back pain, especially if you don't have any structural damage to your body. And instead, have an attitude of what you can do today to improve your lower back pain. This is only going to help you be much more successful at dealing with chronic pain. The tip number 5, in order for you to overcome chronic pain by having the proper mindset, is to have the proper nutrition for your brain. Eat healthy foods that help your brain operate at its highest degree. And how do you know which foods you need to consume in order for you to have a healthier brain? I definitely recommend my patients visit a good dietitian. Dietitians have the education necessary for you to be coached with respect to what type of foods you need to intake in order for you to be healthy and for your brain to be healthy. I'll include a link to my very good friend, Natalie, who is a fantastic dietitian. She'll place you on a 3 or 6 month program to help you get better at nutrition. Nutrition is a science in and of itself, and it can definitely help with chronic pain by attacking chronic inflammatory states and by helping your brain operate at its highest degree. That's the end of the 5 tips in order for you to have a positive mindset when it comes to pain, making you more successful at dealing with chronic pain. Thank you so much for watching today, and it is my job to educate you as to what you can do on your own in order for you to be more successful at dealing with chronic pain. Thank you guys. See you next time.